Hi, welcome to another episode of Silver Fox Scotland. And this, I think, will astound you. It astounded me, and I'm used to some of this stuff. But even I was blown away by this. It is an indication, I think, of how bad things have got under the SNP. In 2018, the average response time when you rang the NHS 24 call-in centres was 9 seconds. 9 seconds between you putting the last digit in and them answering the phone. Now there's a guy called Mike McGurdy, former president of the Royal College of Physicians, and he says now the average response time is not 9 seconds, it's 22 minutes. People can die in 22 minutes. That is absolutely horrifying numbers. That is a service spiraling out of control, and this is despite the boast that the NHS have put more money than ever into this service. It's absolutely disastrous. Now, McGurdy himself has he's done this big survey. He says, and that he said, even he was surprised at how bad that had got. He said, but other things that come in that surprised him: 1 in 5 Scots are taking antidepressants. A full 20% of the population are so depressed living in Scotland that they need chemical help. And that's only the chemical help that's legally given by a doctor, not the other stuff, It's horrific. There's a rise in wait times in areas such as radiology, which was 88% higher than just 7 years ago. Endoscopy, for example, nearly 40% higher. In 2013, nearly all inpatients were treated within 12 weeks of the decision. But since September 22, only about 57% of that figure have met the dates met the times on average. So it's almost halved. There is what is called a structural paradox in the NHS in Scotland. He said, which has more staff, more funding, more policy initiatives than ever before, and yet patients' outcomes and experiences are worse than ever and declining. He says since 2007, there's been over 130 major health strategies announced, published, and instigated. And yet again, which is one every 7 weeks, I suppose. And yet again, patients are not being treated as well as they were. He says that the challenges in the NHS were not caused by the pandemic. Some were exacerbated, but they were there already. It merely exposed and enhanced the existing weaknesses. He says pressures, and this is the big one, pressures on the NHS are having a substantial impact on health staff, actually on the health of health staff, who are now more than 50% more likely than the general population to experience stress and depression. Workers are at risk of burning out, and at times dealing with problematic cultures that are actively discouraging the raising of issues within hospitals or health units. They said small tweaks have been made on the delivery of care, such as NHS 111 and Pharmacy First, but changes have been bolted on rather than are sort of fundamental. He says the NHS is falling apart, it's failing. There is nothing that can save it now, apart from starting from the beginning, from first principles, and redesigning it from the ground up, putting patients first. But that would cost, and he says he does not foresee the SNP being willing to do it. This is horrendous. From 9 seconds, though, to 23 minutes. 22 and a half minutes. How many lives is the SNP costing? That's the question we need to be asking here. Are all the deaths worth it if it means they achieve their independence? Because that's what's causing this. Money going to independence and not going into healthcare. That is stunningly bad. And it won't change because people still will vote for the SNP. You know, they'll lose members of their own family. Their own family will be dying around them. And it is the fault of the SNP, but these people still will vote for the SNP because Granny dying was worth it. You can't beat them, can you? Let me know what you think. Thanks very much. Goodbye.